If we are ill, we will not be able to further develop our country because the important resources of the country are citizen. Royal Address of His Majesty King Bhumibol Adulyadej. In Thailand, some people experience inequality in healthcare, which is rooted in a lack of political, social, and economic power. Most of such people are women, children, the aged, displaced people, ethnic minorities, inmates, people with disabilities, people suffering from chronic illness and conditions. Vulnerable populations are defined as those at greater risk for poor health status and healthcare access, and those without adequate potential access to care. Moving beyond health services for vulnerable people at Siriraj Hospital. For over 125 years, Siriraj Hospital, under the Faculty of Medicine, Siriraj Hospital, Mahidol University, has been continuously serving society and undertaking the roles related to education, research, and medical services that are the hopes of people from all walks of life, seeking operating procedures to reduce disparities among numerous patients is a challenge. Professor Dr. Prasit Watanapa, Dean of Faculty of Medicine, Siriraj Hospital, said, "We have to adjust ourselves and further develop medical and education services in response to people's needs. The goal, due to limited resources in terms of budget, personnel, and technology, is to provide overall services for the highest benefits of the people." At this hospital, each year more than 3 million outpatients and inpatients come in for medical and rehabilitation services. That is a very large number. Assistant Professor Dr. Wisanu Kamthorntip, Head Rehabilitation Medicine Department, said, "We focus on a high-tech, high-touch approach in close contact with the patient for long-term examination and medical care. Now we have introduced advanced technology to use in parallel with unconventional method, such as robot for use in walk training, arm-leg training to help patients' mobility. Previously, we mostly focused on physical rehabilitation, but psychosocial aspects had to be assisted by other sectors." The hospital's Rehabilitation Medicine Department provides services based on its capacity at a medical school. New technologies have been continually introduced and applied, in parallel with basic skill development, so as to make the work more efficient. The focus is on helping the clients to adjust themselves and live a normal life. What we are seeing now is training patients to walk so that they will have a normal everyday life. Besides, the services are provided for all target groups. Here is the Pediatric Rehabilitation Division that focuses on a multidisciplinary team approach, rehabilitating both physical and mental conditions. The services are equitable and accessible to all target groups, using diverse rehabilitation techniques. Some cases require specific methods and equipment. Another factor that is important for medical treatment and rehabilitation is the availability of equipment and supplies. This is the Siriraj School of Prosthetics and Orthotics. Dr. Nisarat Opatkiatikun, Director, Siriraj School of Prosthetics and Orthotics, said, We have been collaborating with several public and private agencies in developing parts of prostheses and orthoses, or prosthetic and orthotic devices, so that their qualities are comparable to imported devices, but they are cheaper. Thus, the services are better at suitable prices, not too expensive. We would like to improve the patient's quality of life, helping them to not only walk, but also run, bike, exercise, and take part in social activities, and helping them to improve their general health conditions so that they can more actively participate in social events, have an occupation to earn a living like normal people. This is our goal. Persons with disabilities are also human beings like other people. They only have physical limitations, so we have to give them opportunities to live with dignity. Today is another day that Mr. Somsak, an athlete with a disability, comes in for changing his leg prosthesis, or artificial leg, to fit his everyday life. The school provides services and also conducts research studies. Mr. Somsak Kakun, a person with physical disability, left leg amputee, said, "Today I come here to get my new leg prosthesis, left artificial leg. The old one had been used for 15 years. With the new one, I can walk for a longer period of time. I think that prosthetic and orthotic devices help people with disabilities to have better quality of life. Better devices make us more confident in using them, can fulfill what we are missing." In addition, another role of Siriraj Hospital is seeking suitable and possible ways of life for the people who have to live with unavoidable illnesses or conditions. What we are seeing now is vision treatment and rehabilitation at the Low Vision Clinic, seeking a way out for people with vision problems. Assistant Professor Dr. Chakrapong Namad, Head, Ophthalmology Department, said, "We realize that our work is to help people with visual impairment to have a way out in their life, as when they are sick, finally they may not be treated. How can we help them to have a normal life?" Vision Rehabilitation Clinic. At this clinic, we provide continuous holistic care, covering illness treatment with holistic care also for physical, mental, social, occupational, educational, in collaboration with other sectors, with the ultimate goal of helping the patient to help themselves. In the meantime, the services are supplemented with identifying ways to help visually impaired people to live a normal life. In accordance with the treatment and rehabilitation guidelines, a place has been set up to exhibit examples of promoting the accessibility of people with disabilities. This place is the Siriraj Pimuksathan Museum that has set up systems for visually impaired persons to visit and gain knowledge with a mental effect. Two blind persons' perspective after visiting the museum said, "It is like opening a broad world for us. We can see what we have never seen before. We can enter and can learn with what we have never known before. We can touch what we never accessed before. It is very useful. We can learn from real life at the museum, with fun and happiness, gaining more knowledge. Many objects have been specially designed for the blind." Associate Professor Dr. Tumtip Sangruti, Chief Siriraj Museum, said, "The exhibitions have been designed to enhance easy access for the blind, the deaf, and the elderly, who are actually not inferior to normal people. However, they may have some difficulties perceiving something. So we need to provide both fun and knowledge-enhancing activities similar to normal people. We are trying to really respond to their needs." What we are seeing now is a staged performance reflecting various aspects of human life, the last part related to medical care. It aims to tell the people about palliative care at Siriraj Hospital and raise awareness of this matter among relevant persons. For example, the Pediatric Palliative Care Center, Department of Pediatrics, is tasked with coordinating palliative care, actually undertaken by a multidisciplinary team for patients and their relatives to get through the time of grief with compassion and relaxation, using various activities for them to practice. Assistant Professor Dr. Kaviwan Wirakun, Director, Siriraj Palliative Care Center, said, "Palliative care for the patients is holistic care in collaboration with a multidisciplinary team from various professions, using the people-centered approach to help the people to realize that death is something that everyone has to face. We help them to have the most meaningful life. For the time remaining, they have a chance to do whatever they want systematically, following up until the terminal stage of their life. The medical team and support team can help the patient end their life in peaceful and dignified way." Here, Buddhist principles are used as complementary methods along with medical and nursing practices. Relevant personnel have been trained on ways to care for terminally ill patients, supplemented with occupational therapies for patients and relatives to ease their sufferings and get through their grief period. These are the examples of service development efforts in response to Thai people's health needs, according to the rhythms of their life cycles, based on the equitable access to health care, as this is the hospital of the nation.